Good day. Uh, I'm Presley Kurkula Surya from Royal College Group of 85. We are having a discussion on COVID pandemic with Dr. Harsha Sathishchandra, the President of College of Internal Medicine of Sri Lanka. Welcome to the discussion, Dr. Satish.
Yeah, thank you.
Yeah. Hi, I would like to ask some questions. Now, the thing is, as far as we know, that there are two kinds of ailments that we can have, psychological and physiological. Out of these physical or physiological ailments, we have communicable diseases and non-communicable diseases. Now, with these communicable diseases, now COVID is or other viral diseases are falling under that as far as we know. So, Satish, please explain us how these communicable diseases work, what happens with the thing, and the bacterial and the viral effects, how it will work.
Yeah, Chris. Yeah. First of all, I must thank you for inviting me to talk to you on these topics. As you rightly said, there are broadly two categories of illnesses: non-communicable and communicable. So, communicable diseases can be due to various what we call pathogens. Pathogens are let's say causative organisms like. So they can be virus, they can be bacteria. Then there are some other groups called protozoa. Now, for example, the malaria is caused by a protozoan. So there are bacterial illnesses, and of course, there's a large group of viral illnesses. So basically, what happens is now these infective organisms, once they get into the human body, there is a thing called, there are two types of immunity in the human body. There is what we call an innate immunity, which is like, say, immunity which is sort of there within us. It's mostly in what we call the points of entry of organisms, like, say, if you take the throat, for example, or the mouth, for example. So there is a thing called the mucosa. Mucosa is the lining of the throat and the nose. So that is one place where the body mounts an immune response to these pathogens. Then there's a thing called the adaptive immunity. Adaptive immunity means, like, say, the body adapts to something that comes in. Like, say, let's say a virus comes into the body, then the body has to mount what we call an immune response. So that is a very specific response. So it depends on exactly the type of virus or the bacteria. So that takes a little time to happen, but it is a very specific form of defense. So you could say that it's the second line of defense. Like, the first line is in the mucosa, mucosa of the throat. So it can be in the mucosa or the lining of the gut. So in various places. So that's more like a first line of defense to try and ward off the invader. Then you get the various immune cells inside the body, and it's a very complex set of things that happens, and so ultimately the body is expected to overcome the bacteria or the virus or whatever pathogen that has come in. So, but unfortunately now what can sometimes happen is this immune system may not be able to cope with the load of the infecting particle, infecting organism. So let's say a load of virus comes into the body. Sometimes the first defense fails, and the second defense, I told you, takes some time. So even that, I mean, the virus or the bacteria can overcome that second line of defense. So it's important for us to realize that there are, organisms or agents which can cause disease even in healthy individuals. Now, we would sort of expect a normal healthy person to have a good immune system, and we would say, okay, we should be able to fight off any organism, any bacteria, any virus. Well, it can happen in most instances, but not in all instances. Now, if you get a common cold, like say a common virus causing cold, of course the body will overcome that very quickly. But then, if you get a what you call a novel organism like the coronavirus, or maybe an influenza virus, a new strain of an influenza virus, then the body has no prior memory of trying to ward off or fight a similar organism. So then the body has to do it all over again, like say do it new. So it takes time, and that is when problems can happen. But of course, people can, if they, we say in general that people who take care of themselves, who eat nutritious food, who get, enough relaxation, enough rest, enough sleep, they will be able to have a reasonably good natural immunity. But that's a must for everyone. I think everyone should attempt to get that level of immunity. But then once in a way, there will come a organism, a bacteria, a virus, which will sort of need something more than the natural immunity. So that is what I think probably we are facing now. So that's a bit of a summarized version of what happens in communicable diseases.
The next thing that I want to ask you is that now, as we know, the viruses could be destroyed by sanitizers. I mean, when it is outside. When it goes to a human body, vaccine is the medication. How will that work? How a vaccine work against a virus like this?
Yeah. So what the vaccine does is it actually sort of simulates an infection. You know what happens is now by giving a vaccine, what we are doing is we are introducing a particular organism, a part of the organism, a protein particle of that organism into the body. If we get down to business and talk about this coronavirus. So the coronavirus vaccine is a vaccine where you insert either the whole virus, the killed virus, or you insert a part of it, or you insert the genetic material of the virus into the body. So you give the body, sort of a picture of the virus. It's like, so it's in a controlled way. So what the vaccine attempts to do is that it tries to promote the body to mount or to sort of form an immune response. Now, what is meant by an immune response is, that the one that I call adaptive immune response. So that's like the body is reacting to this virus. So what happens is then the body recognizes there's a foreign particle has come in. So there is there's a bit of a cascade of events that takes place. So, and finally, the body will form what you call immune cells and memory cells, which will recognize this particular virus in case it attacks the body again. So it's like we have pre-prepared the body for this virus. Now, let's say we have given a vaccine to a person. So the vaccine is expected to what we call mount an immune response in the body. So the person has mounted that response, and then that's it. So the virus, then the body will retain that memory. Then let's say 3 months down the line, the actual virus comes in, say from another person, that individual breathes in the virus. So then what will happen is there will be this, what we call, told you about this mucosal response, like the local defense mechanism that will also start acting, but it may not work 100%. Then immediately the what we call the formed memory cells will recognize this virus, and it will mount that very specific immune response to destroy the virus. Now, the advantage of this is that it can happen very quickly. Otherwise, if you take a non-vaccinated individual, in that person, the body has no sort of idea of the virus. So when the virus comes in, the body has to sort of form this immune response, and that takes time. So unfortunately, if the virus, what you call the infecting dose of the virus, if there's a large load of virus that comes into the body, then remember the virus multiplies as well. It just comes in and then it multiplies. Then what happens is inside, if there's a large load, then it can overcome the immune system, because the immune system takes time to act. It may take about another 5 days or 7 days to fully form a good response. So in the meantime, the virus multiplies a lot and can overwhelm the body. So then, of course, the person gets very ill, and that will lead to severe disease. So by vaccinating, what you're attempting to do is you're cutting short the time taken for the body to mount the immune response. And the quicker the body mounts an effective immune response, the less virus there is to be neutralized. So that can happen in reality. So I mean that's what we aim for. So, and after a vaccine is given, then the body retains these, what we call these, there is, what happens is that there's a thing called antibodies which are formed. So these antibodies will remain in blood for quite some time. So, I mean, if you take a blood sample and check on that, you will detect these antibodies in blood. So we say now that at least for about 6 months, these antibodies are detected. Of course, the levels can come down, but they'll be detected. So antibody is one way of fighting the virus. There's another way called what we call T cells. There are a group of cells called T cells which fight the virus. So there is a T cell response as well in the body for vaccination. So that response, we actually do not know for how long it lasts, but it lasts longer than antibodies. So it may be even 1 year. So that may last for a longer period. So that's why we talk of boosters. Thinking of the antibody level. So sometimes, there's an argument even in the scientific world that boosters are not needed because, the other type of response, like the T cell responses, may be quite good. But then, I mean, we want to ensure that the person doesn't get severe illness. So that's why we talk of the need to give boosters, at least in some people. Of course, there's one small thing about vaccines. Now, say some people, now vaccines are supposed to be immunogenic. By immunogenic, we mean that the vaccine should be able to sort of promote the body to form these antibodies and the other responses. But in some people, it doesn't happen. So that's actually not exactly a fault of the vaccine. It's supposed to happen in most people. In some people, if that person is immunocompromised, that is, if that person's immune system is weak, then that person may not be able to mount a good response, then have antibodies and then these T cells. So that is why in some people, even after vaccine, if you do the antibody levels, now we say a person gets immunity after vaccine, let's say about 2 weeks after the second dose of the vaccine, or if it's a single dose vaccine, 2 weeks after that particular dose. But in these individuals, it's not a common thing, it's a rare phenomenon. You don't see these antibodies form. So actually, they are not protected. So what can happen is that if the virus attacks them, then they can get even severe disease. So, I mean, we sort of think that, okay, the vaccine is not working, but it's actually that, well, it's not working true, but it's not that the vaccine has sort of failed as a method of inducing immunity, but it's just that the body has not been able to mount that immune response. So we have to be a little careful about judging vaccines on the basis that people still get disease even after being vaccinated. Of course, the main thing about vaccines is that vaccines will prevent severe. If you take and of course, it can eradicate diseases as well. Now, if you take a vaccine like smallpox, the vaccine that we had for smallpox was eradicated through the vaccine. I mean, we don't see smallpox at all. So not only was the vaccine effective in preventing severe disease, but it sort of simply eradicated the dangerous virus. Here with COVID vaccines, we don't have that sort of a vaccine right now. Of course, I mean, new vaccines are being developed. We may have one in future, we cannot be sure. But the main thing is if we can limit severe disease, if we can stop severe disease, if we can stop patients from going into hospital or going into ICU and dying, then the vaccine would have done its job. So, I mean, that's the general thing. So that's how vaccines work, and I think vaccines have generally been very safe in most instances. Or if you take, immunization programs for children, they have worked very well. Now about this coronavirus vaccine, there is one argument that this has been done in a hurry, and we have sort of made vaccines over a period of 1.5 years or so. So there is a query whether they are safe or not. But of course, this vaccine, even though the vaccine took a shorter time than usual, I think generally they have adhered to the usual protocol. They were able to do that because these vaccine platforms, we call them platforms, the technology has been there for many years. Now, say if you take the AstraZeneca vaccine, now that platform has been there at Oxford for 10 years. So they just had it. They just had to find the genetic details of the virus, and then from the next day onwards, they started for making the vaccine. So and most of the vaccines are general vaccines that we've been sort of used to. So I think we need not fear them. Because they have been effective so far in limiting the pandemic.
Yeah. Now, as the third question, now we know that the bacteria and other things, we use drugs, rather antibiotics and some sort of medication. And for viruses, why do we get vaccines or injections? As we know, what's the idea of having a vaccine? Can't we have a kind of another pill or syrup or something like that to curb this issue?
Yeah, that's a good question. Yeah. So I mean, we have antibiotics for bacteria, and we have what we call antifungal treatment for fungi, but we don't quite have effective antivirus for most of the viruses. But we do have for some viruses. Now, if you take HIV, now we do have very specific, very effective treatment for HIV. And if you take, there's a condition called herpes simplex virus. Now we have very particular drugs for that. And then hepatitis C virus, we have particular drugs. But for these viruses with very short incubation periods, and generally viruses which are transmitted through what we call droplets, where the illness is quite rapid, we don't have very effective drugs, although there are certain drugs. But if you take COVID-19, of course, there are certain drugs that are being developed, but there is no, shall I put it this way, very effective antiviral as of now. There are one or two drugs which are being used, which have a mild effect on the virus. So they're not quite effective as antibiotics. If you get a bacterial infection and if we take the antibiotic, we feel better within 2-3 days. So we don't quite have that kind of drug against COVID. One issue is that viruses are not they are if I may say so, a bit unstable organisms. They change a lot. So I think that is one issue in forming proper treatment or pills or syrups for that. But of course, that does not mean that now, say, if we take viral infections, there's what we call supportive treatment. Now, say, even if we don't have an exact what we call antiviral drug, there are lots of other methods of treating the infection, because it's not just the virus that sort of causes damage. We say the interaction between the virus and the immune system. Now, for example, if you take dengue, now what causes the problem in dengue is not just the virus, it's the what we call disorderly immune system, immune reaction to the virus that causes damage. We know in dengue there's a thing called leakage of fluid into the tummy and various places. So that happens under the influence of the immune system. So there are methods of treating that, not particularly in dengue, but if you take COVID-19, there are very specific methods of treating this, what we call dysregulated immune reaction to the coronavirus. So it's not that COVID-19 is without any treatment. Now we know that 80% of the people who get the virus will clear the virus within a week, and they are quite well after. And only about 20% will go on to need hospital care and sometimes ICU care and all that. In patients who develop severe disease, we do have these supportive forms of treatment, the way various methods to control the immune system so that the body does not get damaged. So, but antivirals are specific drugs which can stop the virus in its tracks, stop the virus from multiplying. So that kind of drug we haven't quite found yet in COVID-19. But we do have for other viral illnesses. Influenza, again, we do have one drug called oseltamivir, and Tamiflu is the trade name. So that has a partial action, but not not complete action. So here in COVID-19, we may come up with an antiviral drug. There is one drug that is being tested now, which seems to be showing promise. It may be a useful treatment, but it won't be a 100% effective treatment like let's say an antibiotic for a bacterial infection. So that is one issue with viruses. That's why we say viral infections in general are self-limiting. We don't have to do much. The body overcomes them. But then there are exceptions as with COVID.
Right.